more than 500 people that have registered, but as we speak, we have just a little above 100. Do we suggest we wait 5 minutes, then we start? Some of them are rushing to join in. As I'm looking at the page, the number keeps increasing. I want to crave our indulgence. Now we have 135. Possibly we start the moment we hit 150 or thereabouts. Please, what do you think? Is our show, is the way we want it? We have more than 500 that have registered, 136, 137 now. Do we wait till 110 to be precise? At 110, no matter the figure we have, then we can start. Thank you so much. At exactly 110, we will start this webinar. Now we have 140 participants, 141. The number keeps increasing, 142. So please let's wait for just 5 minutes more. At exactly 110, I will start. Thank you for your patience.
Please check the chat box frequently. I will be sending the YouTube YouTube link, and I'll also send it to those that could not get in through to the webinar. So it's streaming live on YouTube as we speak. Thank you all for responding, for chatting. I can see Mr. Eku Oyinloye, welcome. Mrs. Omolara Oladapo, welcome. Maybe you can please add your school name or the school you represent, so to make the introduction better. I can see a representative of Zayat Land School. Welcome, sir. We also have Majekodumi Grace. We see you all. Representative from Gozam Heights Nursery and Primary School. You're welcome. We have a representative from Zamani College, Kaduna. Wow, all the way. Welcome. Thanks for joining. Representative from Dr. Scotland, head of Antos. You are also welcome. We see you all. We see all the chat. Thanks for joining. We'll start in 2 minutes. We have 177 participants online now, and I'm sure more will still join. Great response from participants.
Okay. Good afternoon once again, everyone.
Good afternoon, sir.
Exactly 10 minutes after 1 o'clock, and we have about 119 participants who have joined in. We hope that others will join us as we continue. On behalf of the Director General Office of Education Quality Assurance, Ministry of Education, Lagos, Nigeria, I welcome every one of us to this webinar. This webinar is one of our activities aimed at supporting schools to reopen successfully amidst the pandemic. Unfortunately, our DG is unable to attend this meeting because he is slated for yet another state meeting. So I bring greetings from her. She's happy that all of us are here, and she wishes that this meeting is successful. As you may recall, that this webinar was supposed to have held yesterday, but because of low turnout of people, we had to shift the webinar to today. The reason for the shifting is because the issues to be discussed are so important to every Lagosian. Our belief is that if you want anything, any policy to be implemented successfully, you must involve the teachers. And that is why we are going through this route. So we welcome our team of experts from the Ministry of Health, Health Management Board, and others. Please, I welcome Dr. Bisola Adebayo, in charge of surveillance. I welcome you, madam. Thank you so much for cooperation. I really want to welcome Dr. Adetoke Adeki-Iton, in charge of program. You are equally welcome. Dr. Bumi Okunu, the coordination leader. I want to thank you so much for your time. We have troubled you so much, but we have stuck together. We are working together for Lagos, and we will not relent until our good is better. I also recognize Mrs. Shola Azan from the State Health Board. Thank you for joining in. That's in the part of the health sector. From the schools, we have on this platform a group of technocrats who have come together to form an association that we call COPSAIL. COPSAIL stands for Conference of Private School, all private schools in Lagos. Conference of all private schools in Lagos. So their president or the chairman is Dr. Ogunsoya, Dr. Femi Ogunsoya. You are welcome to this meeting. Thank you so much. Another member of that group that I've seen is the chairman of MUSPAS, Muslim School Proprietors Association of Nigeria. That's Dr. Alhaji Ayuba Muhammad. You are also welcome. My name is Adeyemi Adebayo. I'm the Director of Private Education and Special Programs. I welcome you all and thank you for this webinar. So at this point, I want to hand over to Dr. Bumi Okunu and Dr. Adetoke Adeki-Iton and Dr. Bisola Adebayo to please start the webinar. Thank you so much.
Sir, we also have Mrs. Oyewole and Mrs. Onigbogi, CD5 online, sir.
Oh, thank you so much. Mrs. Oyewole is Director of Policy Research and Statistics of the Office of Education Quality Assurance. And Mrs. Onigbogi is one of our zonal directors too from the district. They are all directors in the Kiwi. More directors from us will join in, but we would like the meeting to start now. Thank you very much, Mrs. Faucia.
Yes, sir. Dr. Adeki-Iton, over to you. Okay, Dr. Okuno, sorry.
Okay. Good afternoon, everybody.
Good afternoon, ma'am.
Good afternoon. As earlier introduced, my name is Dr. Olubumi Okunu. I am the School Health Program Coordinator for the Lagos State Ministry of Health. Ably here with my school surveillance team, as we have become, Dr. Adebayo, Dr. Adeki-Iton, and Mrs. Hassan. We will be presenting this afternoon on the safe reopening of schools. Yes, schools have reopened already. However, the whole idea of this presentation is to reinforce safety protocols, especially pertaining to COVID, because we do know COVID-19 is still in play in Lagos State. And the idea of reinforcing is to ensure that our teachers, our children are fully protected, very aware of the situation in the state, and fully armed with the information and necessary tools required to protect themselves against COVID-19, as well as the plan if a child or a teacher is found with COVID-19 in school and what should happen. So our presentations will be taken by the four of us, beginning with Dr. Adekiton. Dr. Adekiton is the School Health Program Officer at the Primary Healthcare Board, and she will be starting off our set of presentations. Dr. Adekiton, please.
Good afternoon, everyone. Thank you, Dr. Okino. Thank you, Mr. Debayo. We appreciate this time. May I be allowed to share my slide, please?
Yes, ma, you can share your slide.
I can't see that icon, that's why I'm asking.
You are permitted to share your slide, madam.
All right, I'm doing that already. Just hold on for me. Okay. Okay. Technology. Can you see my slides?
Yes, ma, we can.
Okay.
Though you've not started the slideshow.
We'll start a slideshow. I just wanted to confirm if you can see it.
Okay, we can see it, ma.
Okay. Sorry, I've gone way ahead. Okay. Good afternoon once again, everyone. My name is Dr. Adekito Adetoke, as earlier introduced. I'm the School Health Child Protection Program Officer for the Lagos State Primary Healthcare Board. It's a great privilege to be at this training, having to interact with a lot of educationists. I know that we all have one idea or the other concerning COVID-19, but this training is actually geared towards having a unified information, which is evidence-based according to what is happening. We know there are a lot of things out there, rumors and everything, but this training is for us to know exactly how things are. These slides were put together by specialists, people that have managed cases, people that have surveyed cases, and have seen what the true picture of COVID is in Lagos, especially. So every information we are going to be giving to you today, I can assure you that you can take it to the bank, because that is exactly what is it about COVID. And then I will implore us that whatever we are taught here today, we should adhere to this so that we all have one form of information. We don't want to get to a school, and that's why we ask for a training like that, because we don't want to have information that are not uniform and people are talking about different protocols. So I will be starting, as earlier been introduced, before people are here. So I'll be starting with the introduction. At this session, it is expected for every participant to know what COVID is, how is the virus transmitted, who is at the higher risk of infection, how do we identify a suspect case, which is a major part of our work as teachers, head teachers, administrators in school, how the disease develops, and then how can we prevent transmission of this disease, especially in schools. What is COVID? For the first time, COVID, we all heard about in December 2019, and then it was first reported in China. And then the thing now spread throughout the world. So it is a disease that is caused by a new known virus. The virus is called SARS-CoV-2. So that's the first time we are seeing the disease December. That's in China. But in Africa, it was reported first in Egypt, and that was in December 14, 2020. Today in Nigeria, we've had a lot of cases, and then we have over 70,000 cases that have been reported. And the disease, we know, it actually mainly affects the respiratory system. And when we say respiratory system, we're talking about the lungs, the airways in front of the bronchioles, and this happens as we breathe. What is the source of COVID? This is a big question we all ask. Where is it from? Some people are even saying that it is God getting angry. Some people are saying it's plague. Some are saying it's a biochemical weapon. But the source for us is yet to be known. It's not known. What is known are the things we talked about, that was first reported in China, and they were linked to a live animal market in China. That in China, there are live animal markets where you can buy animal lives and all of those things. And then likely to have originated from an animal source is what we know presently. And then the virus is now spreading from person to person. That is how well we know that this virus is being transmitted. There have been changes or mutation in the virus affecting the ability to spread. When virus mutates, that means it's like they are changing their codes, which make them to kind of spread better and then change their color so that whatever it is you are doing, they can bring you another side of them. So they are mutating. And when viruses are mutating, it makes them be able to spread further. A lot of investigation is taking place presently so that we can understand it better and then be able to stop the spread. We also have vaccines that are being worked on. I'm sure we've all heard about that. Vaccines are available presently, and then they are being administered as we speak. Like I said earlier, COVID has been traced to have originated from an animal source like a bat. And then our first reported infection was in China, and it spread from person to person. We are trying to get this to understand this virus better, and a lot of vaccine work is going on. But we have 3 companies presently working on vaccine, that have actually produced and finished vaccine, and they have been administered. We have Pfizer BioNTech vaccine. This is said to have about 90% effectivity. It's effective 90% that, okay, if you take this vaccine, it's expected that to work very well at 90%. We have Oxford AstraZeneca vaccine. This is actually from Sweden. And then we have Moderna vaccine, which is about 94.5 effective. How is this virus transmitted? This is another big question that we all ask ourselves at different times. Some had said that it was airborne. Some people have said that it's I don't know, that anywhere you go is in the air, kind of. That has been what we've heard. But mainly the way the virus spread is mainly through droplets. And these droplets come from the nose and the mouth. And then from the nose and the mouth now is either when someone coughs or the person sneezes or speak. So these droplets, when they come out, I'm sure if you can see my screen, you see a picture of somebody that just cough. You can see that projection. It is about 1 to 2 meters. And imagine people in a crowd, like what you can see behind the man. These people in red, they are in a crowd. The people that are in red are people that have probably been infected. And they cough because they were not like 1 to 2 meters apart. Then it goes that way. People can be infected through that when they take it in, through when you inhale it and everything. So it can be spread through that. It can also be spread when these viruses actually drop on surfaces, and then you put your hand on those surfaces, and the same hand you put it in your eyes or in your nose. That's like the transport medium for the virus. So it can only go from your mouth, your nose, and your eyes. And that's why the issue of continuous hand washing is very important, where we can actually break the chain of this virus. People can also transfer it through door knobs. When you touch door knobs, any surface, so far the virus is on it and is not taken out, it can thrive on it and it can be moved. These are also surfaces we can pick it from that we may not even think, because some people, when they are infected, you hear, I don't even know where I got it. Where did I go to? What did I do? So this virus can stay in your hands, on clothes, on the skin. You can actually would have entered bus with someone and the person have the virus on their cloth, and then we are touching each other with the clothes. And when you get home, you pick the same clothes, you remove it, and it's in your hand. In the process, you just try to itch your eye or try to itch the nose, and voila, the virus already has a way into going into that. Through plates, there are all surfaces, cups, pots, cutleries, magazine at work. When you go to work and you pick magazines and you pick newspapers, you probably don't know whether somebody that was infected had gone there, sneezed around the place, and everything's already sitting on the paper, ready to be picked up. Door handles, stair rails, tables, these are all areas and places where this virus can be picked up. Toilet and bathroom, yes. Sure, you'll be surprised. There's evidence that this virus can also spread by human body waste products like feces and urine. So toilet hygiene is meant to be utmost right now. And we know in schools, we use toilet, we use bathroom. We have to ensure that in as much as we disinfect our toilets, we should decontaminate. There are two different words, but we have different solutions that determine what is what. So when you finish washing, you can put some of all these bleach elements, different types, into it so that you can decontaminate. Cleaning both bathroom and toilet surfaces regularly and disinfecting with bleach will help. Washing hands after visiting bathroom, which is our normal hygiene, it should just be talked more about. Every child is trained to say, after toilet, wash your hand. But right now, we have to ensure that whatever it is they are washing, they are washing it well and then doing the right thing. You can be pouring soap and water in your hand and not be doing the right thing. I'm sure by the time you get to the IPC part, our health educator will be doing justice to that. And also, all this has helped to reduce the risk. Who are the people at higher risk? Why are we worried about school? Who are the people that are the most vulnerable in getting this disease? Globally, we have different set of people. The older people, they are at risk of this infection, people that are over 60 years of age, because this disease has a lot to do with immunity. When the immunity has dropped, it actually allows disease to thrive. Diseases that have people that have diseases that affect the lungs, like TB, asthma, and then heart disease. Also, people that are diabetic, people that have kidney disease. Please excuse me. People that have kidney disease, liver disease, and heart, they also can, because already the disease state has dropped their immunity. Any condition that affects the immune system, such as cancer, autoimmune disease, can also put the person at risk. People who are overweight, men appear to be more vulnerable from research than women in COVID. That's globally. And then we have it as our own, on our own side as Africans. We have our own peculiar risk factors. And then these are also still being investigated. People with HIV or TB, obviously we know that if you have HIV, if you have TB, we can see that the immunity has actually dropped. So this also affects the vulnerability. People with malaria and other endemic diseases, Nigeria is malaria endemic area, so we are really at risk. People with poor access to water and sanitation. Remember I was saying, wash your hand after toilet, do this, do that. So if you are in a place where you don't have enough water, if you are in a place where the sanitation is not clean as per toilet, definitely there's vulnerability. Living in overcrowded areas, we are saying people should stay 1 meter, 2 meters apart. In some areas, you can't really stay, but the people can live separately like that. So that makes us to be more vulnerable. And that's the same problem we have with our schools. Our schools are overcrowded. We have children, about some schools, we have about 50, 70 children in classes. So this is part of the vulnerability. People who are malnourished, obviously when a child is malnourished, immunity is down and the child is actually vulnerable, whether a child or an adult. People that lives in a poorer part of the community, the sanitation part will be a problem, access to water will be a problem, overcrowding will be a problem. So they are at risk also. So how is a suspected case of COVID identified? How can we see someone and say, oh, this person is suspected for COVID? So we have a list of symptoms and signs here. Anyone with cough, which is standard, cough and or fever. The issue of cough in the last 2 weeks, not somebody that has been coughing for months. With one or more of these symptoms, difficulty breathing, that is like a major pointer in COVID, suspecting a COVID. We have cough. We have a lot of diseases that are coughs, as that cough is like their signal, like symptoms to that. However, when you see a cough and you are seeing difficulty in breathing, it is suspected to be COVID until proven otherwise. Cough with sore throat, cough with low taste, loss of taste and smell, tiredness, muscle aches, headache, diarrhea, shivering, and like in chills, like in malaria, running nose, as we all know as catarrh, is actually also one of the things that once we see, especially, you know, all these children, they come to school sometimes and they say, they have cold and then, but they are fine. Right now, any child that has running nose should not be in school, irrespective. Any child coughing should not be in school. Any child with sore throats and is already school and is already complaining, I'm having sore throat and the rest, should not be in school. It is not a season of saying it's just catarrh. There's nothing like just catarrh right now. It should be taken care of, and then attention must be paid to such things. How do we know if someone has COVID? How do we say, okay, this person, with everything we have talked about, this person has COVID? The person must have the symptoms we've talked about as suspected case. That's, we are suspecting it to say, with this cough, catarrh, you have sore throat, like trying to investigate something. Okay, what else do you have? Okay, this one, okay, that, then you start thinking. But for you to now think that, for us to know this person actually have COVID, a sample needs to be collected by a trained healthcare personnel, so that we'll know that, okay, this cough we are saying, is it COVID related or not? And this sample is analyzed at the lab using what we call PCR to look out for the virus. And once the virus is seen, the person is confirmed to have COVID. Can infected people without symptoms spread COVID-19? We ask about this all the time, and this is our major fear in this outbreak, in this pandemic that we have, that people who don't even have symptoms, pre-symptomatic people that are infected, and they can go ahead to develop symptoms. And these same people can actually spread this disease. So far, you have contact with that person 2 days before, and that's why whenever we are doing contact tracing, we go 2 days backwards to say, where have you been 2 days before now? Because before that time that a person have the symptoms, you can actually transmit this disease to somebody else. So it is very important that sometimes you see some people, their result coming out positive and they tell you they don't have any symptoms. And that is the danger. They don't have symptoms. And like we are in Nigeria, once we are not sick, we don't have a reason to stay away. We don't see any reason to go to the hospital. And that's why screening, testing also is one of the things that is like a strategy to ensure this pandemic is put to an end, even though it's quite an expensive strategy, but it's still there. How the disease develop? It can go from mild to moderate. From other countries, we have seen that almost 80% of the people only develop mild to moderate disease. And then when you have like mild disease, it's expected that you stay at home, you don't leave the house. And then as the symptoms come, someone gets to call you, like a surveillance officer, trying to look out for you. And this is called home isolation. And this is done so that the person does not keep on spreading the disease. So it's mild, you're not symptomatic and everything. So it's expected that you stay at home. This kind of person should not go to school. This kind of person should not go to work. If there's a teacher that has mild symptoms and say, okay, I need to have my children, my student and all, this kind of person must stay away for 14 days. Even if they start feeling better, it is expected that they still stay away for 14 days. They should continue to maintain their proper hand hygiene, which is the hand washing, proper respiratory hygiene, which is coughing and sneezing into our elbows, and then keep physical distance to further reduce the spread, even as they are at home. You know, you are not going to be home and say, I'm in my house. These people they've been living with me even before this COVID. So you are supposed to stay away from even the people in your house. Isolation, that is by yourself. That same person should contact health center whenever they start having difficulty in breathing. So you don't feel that, okay, I'm being managed at home, it's mild. But if you have progression in symptoms, the person is expected to go to the nearest facility. Also, when staying at home, I've said this before, this person needs to stay away, like 2 meters away from the other family member. Wear medical or fabric face mask over their nose and their mouth, even while they are at home. Nobody should say, because I'm home, I can't transmit, even though they've been with me. They are meant to still do all this protocol and try not to share household items. I'm sure we can see from all those means of transmission. We can see the plates, the cutleries and everything, and wash their hand as much as possible. The word as much as possible is the key. It's not timely, it's not only probably when you eat, it's not when you go to toilet. You have to wash it as many times as possible. So this will be talked about more. Around 20% of the people, we've said 80% will be mild, but the moderate to severe will be about 20%. And one of the first signal that shows that this is growing from mild to moderate is difficulty in breathing. They should cover their mouth and nose with a medical fabric immediately.
Hello.
I think Dr. Adekito has a problem. Can you hear me?
Yes, ma'am.
Yes, we can.
Once the person start losing breath.
Dr. Adekito, we lost you for a minute. Please, can you start that slide again? Thank you.
Can you hear me?
Yes, we can hear you
ma'am.
now.
Okay,
Yes.
I think I had, can you see my slides?
No, you have stopped sharing it, ma'am.
Yeah, it will share now. I think there was a break in that, the network went off for just 1 second, I guess. Can you see it now?
Okay, it's back up.
Okay. So I was saying people that were severe cases are meant to go to the health center. COVID is not something you want to manage at home once you have complications like difficulty in breathing. Okay, my next slide. Technology. Okay. So how do we treat COVID? Presently, there are no specific treatment for COVID to say take this, take that, then the COVID will go. Just like malaria, we have artemeter, and then the physiology and the pharmacokinetics can actually be described to say this is how this drug actually takes care of this. But for mild cases at home for COVID, it's expected, what we advise is that the patient should take a lot of water, take paracetamol for the pain and fever. Like treating the symptoms is symptomatic management is what we do with COVID. Eat and rest well. That's for someone that has mild cases. For people that have difficulty to breathe, once they are at the health center, if there are oxygen requirement, if there are ICU requirement, all this will be done. IV fluid for someone that cannot eat, pain relief, oxygen, and then breathing support. So these are all we do to make sure the patient is actually being taken care of. How do we prevent transmission, which is our only joker we have with COVID? If we prevent it and nobody gets to come down with it, it will be better for everybody. So the many ways we can actually prevent COVID are we avoid contact with people who are infected. Let's not say, it's my friend, the person is sick, or they have COVID, they're at home. We know we love each other. Let's avoid this as much as we can. Use greetings that do not involve touching the other person. I'm sure in this COVID, we've invented so many greetings. Head to shoulder to shoulder, leg to leg, as much as we can, because we are people of so much love that we like to touch each other. Even when people greet you and just say hello, hi, and not coming to come closer to you, just feel like, is there anything wrong? We see it as not something not normal. However, these days, it is normal to greet you without hugging you. So we should try as much as we can increase hygiene measures and washing with a lot of water and soap. It's not time to start micing so that the soap can actually kill the bacteria. It's not time to just look for those cheap soap that will not do anything, but it's to get the real good soaps. And then we should learn to cover our coughs and sneeze properly with tissue, and the tissue be trashed immediately. I'm sure we are aware of all this information. Not share items if possible. We are used to it. Give me your Bible. Let me see this. We shouldn't share as much as possible. And disinfect surfaces. The way we go about with our purse and wallets and hanky for our makeup, we should invest in disinfectant wipes so that anywhere we go, we are rubbing it off and ensuring that each step we are breaking the chain. We should reduce physical distancing as much as we can. It's not time for social gatherings. It's no time for somebody getting married and everything, because these are areas where this COVID tribe is spreading. There's no way you want to sit 2 meters apart in a party. We know ourselves. And then it's time for dancing. Will you be apart and be throwing money at 2 meters? We don't do that. But it's to avoid it so that we limit the amount of time we also spend together in contact, like keeping people in a room for too long. These are things we should avoid. In classrooms, no long curriculum. People should close early, and then we reduce contact. I've said this before. So I'm sure at the end of this session, we have been able to let us know that COVID-19 is a disease that affects the lungs. And this lungs is our engine machine for breathing. And once it's affected, the whole entirety of someone's being is affected. We've learned that it spreads through droplets of saliva when an infected person coughs, sneezes, or speaks. Also, people can infect others from 2 days before developing symptoms. So it is not like they discover the person today and then you've had contact with that person 72 hours before. You are also at risk, and then you have to be checked until proven otherwise that you not contact the disease. We've also learned about the important symptoms such as difficulty in breathing, dry cough, and fever. We've also learned that about 80% of infected people will have mild to moderate symptoms. So all the alarm and everything, we need to know that it's only people that are so vulnerable that I mentioned the other time are the ones that can actually have severe cases, and that's about 20%. And we have also learned that to prevent transmission, people must have behavioral change. That's the major problem of this disease, behavioral change. Humans are very difficult to control. And that is why we are having issues with taking care of this disease. If it's that it's something that comes from cow, like all those monkeypox, is better once you put them all together in one place and lock out the monkey or the cows. Nobody is going to cause any problem. But human beings is always very difficult. And that is why all this effort are being put into this training to ensure that we have that behavioral change. We are there to one prevention measure does not take care of it all. You cannot wear face mask and not wash your hand. You cannot wash your hand and not wear face mask. You cannot wear face mask, wash your hand and not have proper respiratory etiquette. Everything must be observed. Everything must be done. You cannot do all of that and say we can sit together. You still have to keep the distance. So please, let us all start with ourselves. Let the change begin with you in ensuring that we flatten this curve of COVID and we have a better environment to go back to our normal, and then do our things the way we used to do. The change starts with you. Thank you very much.
Thank you, Dr. Adekito. Mr. Adebayo, sir.
Yes, Dr. Adekito, thank you so much for that very good presentation. I want to find out, is that the end of the presentation, ma'am?
No, that's my session. Dr. Kunu will be coming up now with school-based surveillance.
Okay, is that the last presentation for the day?
No, sir. It's a webinar, so we have 4 sessions.
We have 4 sessions. I want to have an idea of the span of the remaining 3.
So as it is right now, maybe another 45.
Okay, that will be, it will be over.
Yes, another 45 to 1 hour max.
Okay.
Yes.
Thank you very much. So the next person can please come in. Thank you,
okay. Dr. Kunu. So over to you.
Dr. Kunu.
Thank you, sir. Thank you, Dr. Adekiton. Good afternoon, everyone. I will be discussing school-based surveillance. And I hope you can all hear me very well, though the connections may come and go.
Yes, I can hear you.
Okay, thank you. So next slide, Dr. Adekiton. So generally, when it comes to school-based surveillance, we want to give you an idea of how we have been monitoring and how we plan to monitor in the schools moving forward. This session will cover what is school-based surveillance, why it's important, the communication and surveillance flow chart. This is how we pass information to ourselves and information from the schools and back to the schools pertaining to COVID, case definition, and reporting of what you find. That's the information in the schools as well, and what we send back to the state. Next slide, Dr. Adekito. So what is school-based surveillance? An organized collection, monitoring, assessment, and interpretation of data regarding health signals, events, or risks occurring within school environments and may represent health burdens to school. This is generally the ringer that indicates to us that there's a problem in schools and how we are able to manage them. This means using your knowledge and understanding to pick up if unusual numbers of certain diseases or unusual symptoms are being seen in our schools. For example, a child that comes to school with a simple cold, most teachers know, even us parents know that by the end of the day, a few children are going to go home with that cold. So it's just our knowledge of and understanding of the numbers, how this disease grows in numbers and how we can check it. Next, please. Why is it useful? It increases the chance of detecting public health signals and events early. This helps public health services hear about cases more quickly, which means they can respond faster with prevention, control, and treatment measures. When the response is speedy, it is possible to reduce the numbers of learners and staff that will be affected, AKA a child with a cold. That child should stay at home to reduce the number of other children that may take the cold on. It can catch information that might be easily missed. Next slide, please. Okay, so some important words we'll be using: surveillance system. This is the network that gathers the information about the numbers of cases of different diseases in the population so that unusual changes in these cases can be picked up and investigated, AKA if the numbers are rising quickly. Then signals. Signals are like smoke. You know how we say smoke signals? Things you see or hear in your community that could mean that an event is happening that could affect people in the community. Simple example is Ebola. Once one person in the community hears, it's smoke, the speed at which the information goes out. They can be by a rumor or by something you've seen. Maybe the ambulance with a team of suited up individuals coming. That's a signal. Events are like fires, something that's happening in the community that can spread and cause harm. Like fires, events are best managed when they are small. A health event is something that causes and involves the spread of a disease or illness. Risk. In health, a risk is something that can affect health. It changes depending on different factors. COVID-19, as we know, old age is a risk factor. Those who are older have a greater risk of developing severe disease. Other risk factors could be weight, there are different issues. So this is our surveillance flow chart. We would like each person to get, well, at the end, if we are able to, education will have to send this off to everybody because it just gives you an idea of how the surveillance team works. So in a school premises, we know that most of you have been on the training for the states, and we've indicated that we must have a school focal person. I'll be moving from my left hand of the screen to the right. So I'm starting with school premises at the top. Each school is to have a school health focal person, a school health focal officer that identifies symptoms between in learners and staff. So for example, most schools have gatemen who take the temperature. It wouldn't necessarily be that your school health focal officer should be the gate man. He should be able to report to the school health focal officer chosen by the school that a temperature has been taken for this child or for this teacher and it is above the norm. This school health focal person passes this information immediately to the school administration. Each school will have the surveillance forms. As I said, this is our plan moving forward with all schools in the states, private and public. So these surveillance forms are what the school administration will fill and give to the local government disease surveillance notification officer. Now in Lagos State, every local government has a disease surveillance notification officer at the local government. And we hope education will share it. It has been shared before. The numbers of the medical officers of health, the disease surveillance notification officers across the state have been shared during the initial education training. It will be shared again. These are the individuals who live and work in the community that are notified when there's a disease going on. For example, the issues of cholera, typhoid, issues that Lassa fever. These are our officers at the local government that notify the state. They are the first people to know that there's a problem. Once they are notified, these surveillance forms are sent to them, as well as to the State Ministry of Education, the State Basic Education Board, and specifically the State Health Team. So once these surveillance forms, once that officer is notified, there are two issues. We have issues with boarding schools and non-boarding schools. Okay, a boarding school that is far from the child's home address. We've indicated that every school, boarding and day, are to have holding bays, holding rooms, isolation rooms, where these individuals can be kept. The learner, as the child, or the teacher. So for a boarding school, a holding bay, the child is kept there or the teacher is kept there while parents are informed, because you must get in touch with the parents at home to let them know. And the LGA disease surveillance notification officer will come as well towards that holding day to get that child sorted once the parents come. For a child that is not in a boarding school, we move to the next side where it says send home. The patient must be sent home immediately. I'm not asking that the child is turned back from school. If the parent that is dropping the child off is there, if you are able to call that parent, yes. If not, the child must be put in an isolation room while the parents are informed, as well as local government disease surveillance notification officer. Now, this officer is to contact the Ministry of Health, that is, our COVID response team, they are all very well aware, to arrange case investigation and contact line listing. This information that we've said is just the way the officer gets the samples, is able to carry out contact tracing, because the minute that child is known, as we are doing in most schools, children work in bubbles. If that child has already entered school and gone to a class, that class is a bubble already. The children in that class with that particular pupil are part of the bubble and are part of the contacts, immediate contacts of that child. So the LGA DSNO officer needs to have all that information while arranging for samples to be taken at home or in the school, depending if this child is still in boarding and has not been able to go home. Now, the DSNO gets the information, gets the samples and sends off. We are aware that at the local government levels, there is testing going on at the local government. The samples are being collected at the local government and being sent to our centers. So for this purpose, our centers are the Yaba Infectious Diseases Hospital. So the DSNO is part of that flowchart. She gets the samples, sends off from the local government, noting that all of us have been notified. Now, when the sample gets to the lab, it goes to the state lab, where the state epidemiologist is informed that this sample was from a school, it's being tested. If that test comes out negative or positive, the state epidemiologist will let the LGA disease surveillance notification officer know that the test is positive or it's negative. Now, if this test is negative, maybe the child has a regular cold or maybe had malaria, so regular routine care is done. If this child is, however, positive, we have two options. A symptomatic case is where the child may be having a cough, maybe having a fever, maybe having diarrhea. That child has two options. Is either evacuated to a treatment center, which is our isolation centers, or that child is treated at home, depending on the severity. Dr. Adekiton spoke about mild and moderate cases. Most of us have heard about home-based care, which is what Lagos State is thriving for, because most of our cases are mild and can be managed at home. We also have the other case of a child that may be asymptomatic, showing no symptoms whatsoever. Those cases must still be isolated at home because they are infective. They can go around infecting other children, which is why we say that it is better for a child with even a simple cold to stay at home rather than go into the environment thinking everything is okay and spread the disease to the children and to other teachers. Now, with all this, this is our flow chart. On the end, you see Federal Ministry of Education, State Ministry of Education, SUBEB, the State Health Team. We are all notified of this event, especially because it is in school. The issue of COVID-19 in schools is more of not that our children are falling ill and dying, but our children have the ability to be asymptomatic and are able to spread this disease faster. They are able to spread it by taking it home to the aged, to the obese that are at home with them, and to even other children that have underlying conditions. So everyone is notified so that we are on alert and we can work towards resolving it. Cases are followed up across the states from the different, from the Ministry of Education, from the Ministry of Health, from the state and federal ministries of health. Now, we're moving to the communication flow chart for the school health teams. Now, this is just how information is passed. It's the same way I've spoken about it, but I will start from the bottom of the screen. We have the staff and the learners that come to school. They are checked, and a report, if you find a case, as we say, the information is given to the school health team. The school health team notifies the school authority. Let's remember the school health team is the school health focal officer who reports to the school authority. The school authority, while reporting to the local government school health team, that includes the disease surveillance notification officer and the medical officer of health, while the school reports to them, the school must also report to the PTA and the area, they're called, I've forgotten their name right now. It's like in your community, it's your community group. They are informed as well. Dr. Dixon, can you go back, please? Dr. Dixon, thank you. You must inform them as well that a problem has happened in the school. The child has been found, because we've had issues for certain private schools where it is from outside the parents heard that there was a case of COVID in their schools. It's not as if parents are going to cause problems, but the idea is that once you carry parents along with what is going on, what the school's protocols are, what was done, how the Ministry of Education and Health were informed, parents are calmer. They are happier to leave their children, their wards in school, as long as their children are not part of the bubbles that are affected. But once information is heard outside later on, it becomes, the school is painted as hiding information and not being transparent at all. So from the school authority, the information is passed to the local government health team, which passes it on to the state health team and the national school health team. All in all, we support ourselves with information, testing, everything that is needed to get our pupils well and back into school at the right time and keep others protected. Next slide. We believe that these slides will be passed on to you at the end, so it will not be a problem. Dr. Adekiton, please go to the next slide and we'll come back to this. The slides were flipped. Can you go to the next slide, please?
Okay.
Definition, yes. Let's go to the next slide. It's the same slide. Can you go to the next slide? Yes. So this is what we want to talk about. This is a suspected case. Dr. Adekiton has spoken about it, but I would do it as well. Anyone with a cough or fever or history of a cough or fever in the last 2 weeks with one or more of these symptoms. We know there's current community transmission, meaning that the disease is already in community. People are not isolated. They are walking around and have this disease. So examples are fever, cough, runny nose, sore throat, headache, difficulty breathing, shortness of breath, nausea, vomiting, loss of taste, loss of smell, tiredness, fatigue, watery stool, chest pain, shivering and sweating, muscle pain, body pain, and noisy breathing. Now, I must say something. The person must have a cough or a fever along with these symptoms. Some people, however, may have a cough for one day or have the fever for one day and not have the other signs. So over the last few weeks, we've been speaking to people who say, oh, I had a bit of a fever, but I didn't have, everybody is holding on to loss of taste and loss of smell. Loss of taste and loss of smell, everybody's symptoms may be different. To note, there are some people that have loss of smell, alterations in smell and alterations in taste. However, they have COVID, and because they believed maybe it was the way I felt when I had malaria, they don't go and test, or they just believe that, well, I'll get over it, take a Panadol and walk through. So we must not hold on to the regular loss of taste and loss of smell as the sign for COVID. Many people, I have to be honest, I had a friend who had it, who had just diarrhea with the fever and the cough. He had the cough overnight and he didn't cough again, but all he had was diarrhea. So it makes it, the disease is different for each individual. So we must be careful. So let's go back to the slide before, Dr. Adesinko, which talks about a confirmed case. A confirmed case is any person with a laboratory confirmation of SARS-CoV-2 infection with or without signs or symptoms. A PCR test is the gold standard for testing. For example, now, we know that there are asymptomatic individuals. The asymptomatic individuals have no sign or symptom. They most probably get tested just because there was information that someone had it, or people that are traveling and their children that are traveling and their parents just want to, of course, the airlines are asking for negative PCR tests. Everyone is doing that. And then they find out they're actually positive. To be honest, we've seen a lot of things. We had an individual who was already on the plane with a negative test, got into the UK and did it again early and was actually positive. They didn't catch it on the plane. They most probably caught it in Lagos. But this, I don't know how they got their test, but we found out. And of course, they had to be isolated in the UK. But they tested the next day. Not that they tested, there was something wrong and they just tested and they found themselves positive. So I don't know where the negative test came from. So we must really be careful. Next slide, please, Dr. Dikiton. 2 slides on, rather. So a probable case of COVID-19 is any person that presented with any of the above symptoms in the last 2 weeks and died without a confirmatory test. Usually, such a person may also have an epidemiological link. For example, living in an area of active outbreak and a close contact to a confirmed case. Next slide, Dr. Dikiton. So the basic test steps for COVID-19 case investigation. Step 1, we identify and assess the suspected case. Confirm with the case investigation form. This tells you, okay, have you been in contact with anyone in the last few weeks that has tested positive? Have you traveled in the last 2 weeks and come back? Do you have a cold and a cough? Do you have a fever? We generate an exhaustive list of contacts. This is called contact listing. This is where everybody, for example, where I said a child is in a class and everybody in that class becomes the child's immediate contacts, apart from the parents at home. And a few days back, contacts a few days back as well. Collecting and testing of specimens. We assign a case classification, a suspected case, a confirmed case, or a possible case, a probable case. This probable, of course, is if the person died without a test. We link with case management, obviously, positive cases only. Asymptomatic and symptomatic cases are managed similarly, unless your symptomatic case is more of not severe, where you hear people talking about oxygen management, isolation, they're in the centers. Then we commence contact tracing. This is already, contact listing is already done. So contact tracing is just to follow up with those other contacts who usually are told to isolate for 10 days at home. So they watch so that they don't have symptoms. And later they may be asked to test as well, just to be sure, because they too may be asymptomatic. So generally, this is the whole idea on our school surveillance. You will be seeing the Lagos State surveillance teams from the state and from the local government level moving forward in your schools. Please, let's be prepared, because this is the avenue where we will notify you, as well as the Ministry of Education notifying you, because we will come in moving forward, because for now, COVID is with us and we have to keep ourselves safe. The change obviously begins with us by following up. So I'd like to thank everyone and pass on to Mr. Adebayo. Thank you very much.
Good afternoon.
Beautiful presentation. Can we listen to the next officer, the next person?
Good afternoon. Good afternoon, everyone. Thank you very much, Sam. Thank you once again for having us here. My name is Bisola Adebayo. I work with the Lagos State University College of Medicine, and I also work with the COVID-19 surveillance team. I'll just be taking us quickly on contact tracing and also the checklist adapted from NCDC as part of the safer opening of schools. So I might need to share my slides to make that also possible, so that I can share the checklist. Thank you, Dr. Adikito. So thank you very much. We've gone through a lot. We've looked at the overview of COVID-19. We've talked about symptoms, common symptoms that patients might present with. We've also talked about what the case definitions that we normally use are: suspect cases, probable cases, and confirmed cases. And now in the flow of things, we would like to mention talk about contact tracing, because it's also an important part of surveillance, and it's something that would also need to start right in the school where a case is notified. So in this session, we're going to look at who is a contact, what is contact tracing. We're going to focus on two aspects of contact tracing, which is contact identification and contact listing. And then we're also going to talk about what a contact should do. And then we're going to look at our data tools and, a kind of checklist that we can use within the schools, to assess ourselves. I'm sure that OEQA would have shared this before with us at some point in time. So what do we call a contact? A contact is someone who has been in close contact with a confirmed COVID-19 case in the 2 days before or the 14 days after the start of their symptoms. Where a person is not symptomatic, we consider it 2 days before the person tested, and up to 14 days afterwards. That's what we use. So we go back 2 days, because many people that test may just inadvertently find out they are positive for COVID-19. And what do we mean by close contact? Close contact can happen when a person is face-to-face within 2 meters for more than 15 minutes with a person with COVID-19, having direct physical contact with the person, hugging, kissing, holding hands, which children often do with us, and then caring for a person as well without use of proper personal protective equipment, such as having your face mask on, and then if you're a healthcare worker, you're wearing gloves and all that, and then being in a closed environment with the person. So we'll consider close contacts with people in the same classroom. For boarders, people that share the same room, and then if you have been in a living room or place of worship, or even a vehicle. In our experience, we've also had a lot of outbreaks, in institutional settings, also like, remand facilities and as such. Now, for example, if Mr. A has been confirmed to have COVID, his contacts that will be interested in will include all the people living with him at home, people who ate with him in a restaurant, a health worker who cared for him without proper use of PPE, people he shook hands with, team members in sport teams that maybe they played with, and maybe the colleague that sat opposite to him or her in this state. So by this, I'm sure you all be wondering that, yes, a single case can generate a whole lot of contacts. And many times it's not easy, to find all the contacts. So we focus mainly, at least we start with the close household contacts, contacts at work. If it's in school, those in the child's class or things like that have had contact with the child. So that's what we start with. In fact, during the response, there are many times, we even to supermarket without details to try and let them know that they may have been exposed, so that they know what to do, what to look out for. So we start 2 days before the person started showing symptoms, up to 14 days after his symptoms had started. So what do we mean by contact tracing? So contact tracing involves identifying those who have been in close contact with a case of COVID-19, as we have previously defined. And then we also monitor their health while they are quarantined to note if they develop any of the aforementioned symptoms. So most times when we talk about isolation, we refer to isolation, for confirmed cases, or quarantine, for contact cases. Now, what we usually advocate is 14 days. I know that many people will have questions. There have been modifications in different countries as well. NCDC still says 14 days, but I've been in a situation, that they do a week and then they test everybody. But, the reason why 14 days was chosen was because of the incubation period, of the virus, which is 2 to 14 days. Now, contact tracing is important, even though, as the epidemic increases. Right now, Nigeria, in Lagos, we've had almost 80,000 cases and still growing. So we're having a lot of community spread. I'm sure even within us, almost all of us will have a personal experience. We know someone personally, that has had COVID. But life must go on, like we are saying. And what we've been reiterating in this webinar is that what we should focus on is putting an enabling environment in our schools, that people are open, that immediately they have symptoms, they can alert their appropriate authorities, and then we can set into motion the processes that are required to limit, the spread of infection, and to make sure things are okay so that we don't have to shut down schools. So that's what we are saying, because, life must continue, because we don't know how long this virus will be with us. It's, as people say, we don't like saying it, but it's sort of a new normal. We don't know whether it will become like a flu virus. So we must learn how to live with it and minimize the complications, to our people, to our community, to individuals and to the community, and to increase our resilience. So that's what all we are doing now is for, to increase our resilience against COVID-19, as a whole. So the importance of contact tracing is that it reduces the risk of infection in community by keeping those who might be infected under observation until it is clear that they are not infected, and then quickly identifying new cases so that they can be isolated and can receive care. Now, another thing we do in Lagos, we try to test, very close contacts. We might not have resources to test everybody in a school, but at least identify close contacts and those who may be at high risk. We try to test them so that it also gives us a picture of how the spread has been. And for those that have had some outbreaks in their school, that have had interactions with us, both public and private, you know that that's what we try, to do. We try and do case investigation and then determine those that we think are high priority for testing, and those ones are tested free from Lagos State Public Health Labs. And so the idea with COVID is that, unfortunately, we've lost people. Even this year, we've lost several people. We've lost doctors, we've lost professionals, we've lost, a lot of people, and total numbers. And you think, mortality is not too bad. For everybody that is lost, is 100% for their families and their loved ones. And we would wish we could do anything to reverse that. And for many people, it just starts simply, like what Dr. Kunu and Dr. Adekito have been saying. It may just start like a malaria. So we have to have a high index of suspicion. I tell people, if you have treated malaria once and you're treating it twice within the same period of time, then it's time to get a COVID test done. That's my advice, you understand? So even as health workers, we need, I'm used to saying health workers. Even as, officers in education, we need to have a high index of suspicion. Like what they have been saying, we need to know children that have been absent. So it's not just about symptoms. For school, we need to know. Luckily, we have many responsible parents. Many times parents will call and say, I tested positive, or my child tested positive, so that the school will know what to do. But we need to know children that have been absent, and make sure we investigate to find out the reason, so that when we're looking at records, we can say, this person was absent, but maybe he had something else not related, or maybe something that may have looked at and we've advised them maybe they should test, or maybe the child had COVID. So we need to note absenteeism. Then we need to note children that have any of these symptoms that are in keeping, and make sure we contact our LGs, so that they can get tested. We've shared again. We've shared again with OEQ is the list of the medical officers of health and their disease surveillance and notification officers. Medical officers of health are those that lead, they are the doctors that lead the health department of the local government. So they are the ones closest to you. And I can tell you there are people, these are very experienced doctors, many years of experience in public health. They've been managing outbreaks of all sorts. As they are doing this COVID, we're doing Lassa, they're doing yellow fever, they're doing AFP like all of you would have been familiar with and all that. So there are people that you can call. We send their details, phone numbers, and official emails for the LJs. And there are disease surveillance officers at the boots on ground. They are the ones that you see in the schools, you know, that will come and be disturbing you along with the other members of the multi-sectoral team. So we've shared it so that everybody knows that if there's any issue, please feel free to immediately, you know, reach out to your MOHs and their DSNOs. Because we need to quickly identify cases so that they can receive care, they can be isolated and receive care before complications, you know, arise that, you know, may lead to severe disease. So the important things we need to keep in mind, a contact is not a suspected case yet, because many times we're tempted to say, oh, to test the contacts of the contact. So no, the first thing is to deal with those that have been confirmed with the disease and focus on their own contact. So a contact is usually a healthy person who may not or may be infected. Once a person is manifesting symptoms, according to that case definition that we have heard, that person is considered to be a suspected case. So we need contacts to cooperate, you know, for their own benefit, so that, you know, illness can be managed quickly if it occurs, and for the benefit of communities, for loved ones, for colleagues, to reduce, you know, the risk of passing infection. Like what I tell people, you know, you might be well, many people may not even know they have. But you know, the idea of what we're saying, wear masks, you know, use our sanitizer, is to protect each other. Because, you know, we don't want to be worried that any of us has a severe illness. So it's to be our neighbors, you know, be our brother's keepers, so to speak. That's the importance of what we are doing now. So if we do contact tracing properly, we will spread the risk at which COVID is transmitted. There may be some transmission, but we'll play our own part in reducing, you know, that spread. That's what we're talking about today. So the 4 key steps, we've talked about contact identification. So in schools, by the time, you know, the team is coming around, once you reach out to education and health that, oh, we have a confirmed case, we expect that you already have done that preliminary work to say, okay, we've identified, this is the list. And many of you have done the right thing. I must say, I must give kudos to all the schools that have had outbreaks in Lagos that have reached out to us. By the time we get there, they've given us, this is the list of the people in class. If it's a boarding school, this is the list of the people in that person's room. Okay, do they dine, you know, at a fixed table? You know, they already have, you know, they're on top of those kind of information. And that's what we request from you. These are the teachers, you know, that are in that bubble, you know, that kind of thing. And then to actually list those contacts, identify them, list them in a sheet, you know, so that it's easy to see. And usually our sheet, you see, we will share tools as well with you. We'll share forms so that you can use these things to fill it. We're trying to get that, you know, sorted, and we'll hand over to education to give it out. So to share forms, you know, the name, the age, the sex, and the relevant information from the school. What class, if it's a teacher, what class, if it's a member of staff that is a non-teaching staff, you know, what unit is that person in? If it's a student, what, you know, what hostel and things like that. And then we also do contact follow-up and discharge. That will be handled by the contact tracing team at the LJ. So in the LJ, we have a contact tracing team, the disease surveillance officer and the assistant on that team. Then we have people that are contact tracers, you know, that are working. We have support from partners. So as we're here today, we have support from World Health Organization, from UNICEF. They have people on ground. And then Africa CDC too has people that they have trained specifically on contact tracing that are also part of the LJ teams. And they are working in all the 20 LJs and the LCDAs, the 37 of Lagos State. So they will follow up every contact, and then they will also discharge those contacts from follow-up to say, okay, you have completed your period of contact follow-up, you are free to resume, you know, your normal activities. Before, I won't waste more time on it. So we do contact identification, and we've said the school health team can have useful information, you know, and be asked to help with this. So we ask the cases to go through their activities, people they have been around before their symptoms, and to list it. In fact, many times we tell them, we encourage them to inform those people, you understand, particularly if it's at home, inform, you know, I'm sorry, I was muted. I don't know where you heard me last. So we've talked about contact identification. We walk through with the cases to know who they have been in contact with based on what they have done. So we help them remember what they have done, close contacts, friends and family they visited, people they have spoken to, who they hung out with, and things like that. So we help them try and remember, situations. So we can say, okay, who were you and all that. So that's what we do in the community. And then we list the contacts. So we said, we register them on a list. We try and let them know that they're a contact and what it means and what they need to do. And we emphasize the importance of reporting any symptoms to the contact tracer quickly, even if it is mild. And we also try and answer questions we are late fed. Like some of the things that we have had to do, talking from practical experience. In fact, some points we've had Zoom meetings with PTA, together with the whole team, Zoom meetings with PTA, Zoom meetings with parents, depending on what the school thinks is the need, at that point in time. Sometimes we've even had to contact, because we have a psychosocial team as well that are on ground. Sometimes psychosocial team will also have to interact, with students, with teachers, staff, and other people, parents as well. Sometimes if they think, people are worried and are concerned and they need people to talk to. So we've mentioned this before. Contact list will have the date, name, address, age, sex, occupation of the contact, relationship, when they were exposed, and other key details that we have said, like, what room, what class, that kind of thing. So a contact should stay at home or in a designated facility, because we know that some of them might be boarders, so might need to, shift around to have a place to put them. Ideally, they shouldn't have visitors. They should serve them their food and they take it in, you understand? And if people are in a place where they cannot successfully quarantine, some people might live in a room, maybe it's just you and your family in a room or two, try and maintain a distance from them, and then call the health worker immediately if you develop symptoms. So we've said stay in a well-ventilated room, use, hand hygiene should be a regular thing, should be a norm. So we wash our hands with soap, or we use hand sanitizer regularly. Then constantly use disinfectant to wipe down surfaces that you touch. Even in school, it should be a norm. High contact surfaces, door handles, railings, where a lot of people, they have to open doors. We should make sure that when we are cleaning, all that is done. But I'm sure that will be in another session that will be taken. And then use a mask, and then call a health worker immediately if you develop symptoms. We've talked about physical distancing, and it's an intervention that is important to reduce the speed that the virus is passed from. The aim of physical distancing is to reduce the number of contacts people have if they eventually turn out to be positive, to reduce how close people are to each other, and to reduce how long they are in contact for, because drive factors of spread. So we need to sensitize ourselves, avoid crowds where possible, and shop, at times, when it's less busy, not at peak periods. Try and, do our shopping at a time where we know the places will be too full. Avoid crowded transports if possible. And if it's not possible, we need to wear a mask, even when we're on the bus, even if it's the unpopular opinion. I know that when enter buses, you are the only one that is wearing a bus on the mask, and people just look at you as if, your own is too much. But we mustn't think of that. You understand? We must think of protecting ourselves and our loved ones. And then for family gatherings, postpone them or limit the numbers. We have to limit the numbers now. I gave a personal experience during the last training. My sister got married, after lockdown in November. And even though we tried to limit, not more than 50 people, everybody spaced out, although in the evening they had their own, the young people that had an after party. But I'm telling you, she came down, the husband came down, and that was even, trying to do what was right. In fact, at a point I said, now, man, if anybody asks me, I'll just say, you and your spouse and your immediate family, just go to registry or go to church, do your thing. Later, you'll be doing party. Maybe when you're doing your first anniversary, you do the big thing. Because a lot of people, ask Dr. Okuno and Dr. Adekiton, in the month of, in fact, last quarter of last year, most people that were coming, I went to a wedding, I went to an event, I went to a wedding, I went to an event. That's the honest truth, you know. So those are things that we need to consider. And then maintain personal distance. Usually we say 2 meters because droplets can spread that much. But for classes and schools, NCDC has recommended a distance of 1 meter between students, because at the same time, you have to be flexible. Can't do something that is not impossible to maintain, or else people will keep falling short of those standards. So NCDC has recommended 1 meter distance between students, and students, particularly those age 6 and above, should wear their mask. And then if you have places where you see people that have signs, you need to talk. We need to be each other's keepers. If it's in school, you need to advise. If it's your colleague, let them, you know, go and get themselves tested, wear a mask and all that. So we mentioned again what being close is, and I will repeat, being face-to-face within 1 meter for more than 15 minutes. I'm using school right now. Having direct physical contact with a person, caring for a person without using PPE. And I'm mentioning this here because many of us have school clinics, because there are boarding schools amongst us, even day schools. So even for our clinic staff, the nurses and other health workers, they need to always have their mask. They need to always make sure they are maintaining distance, you know, even while they are trying to care for the patient. And then being in a closed environment. Now, one last important thing about the contact tracing is that COVID-19 is not the only disease circulating. There are other things that can indicate serious disease and outbreaks like fever, diarrhea, and all that. So we need to make sure we keep our eyes open for all kinds of symptoms and encourage the people affected to seek healthcare. And whatever, you know, we're not sure about, please let's reach out to OAQA, members of the health team. We're all one and we're all together, you know, to beat this virus. Now, this is an example of a reporting form that we'll be sharing with you that was shared by NCDC. So it's just, if we have cases in school, how we capture these cases, name, age, sex, their class, and all that. If it's a student, the date the case was identified, and then eventually we should confirm if the person was tested and what the status, you know, was, and how many contacts we have been able to identify within the school. So that is the end of contact tracing. I will just quickly, you know, go over our register. I can see hands up, but we'll just quickly finish. I'll go over the checklist, you know, that we have for schools. So this checklist was adapted, you know, from NCDC, and it can guide what we do, the school health team. So it's divided into safety operations, protection and well-being, learning, inclusiveness, capacity building, and then coordination. This will be shared with us as well. So for safety operations, I'm sure we've seen it before. So we talk about hand hygiene facilities, we talk about ventilation in our classroom, we talk about avoiding mass gatherings, you know, in school, or limiting the numbers where we cannot avoid it. Like I've seen that some schools, they operate, you know, in bubbles, you know, for break time and all that, because I know we say children have to play, it's part of the learning. And then ensuring they wear face masks before entering and while they are within the premises. For example, you notice in many supermarkets, they say, no mask, no entry. But once we enter, nobody cares whether you put it down or you wear it on your head. Nobody cares again after that. And then to disinfect the school regularly and make sure that we're conducting regular health talks. And in all this, we're carrying the PTA along, and we're also, you know, talking to them as well about what we're doing. And then proper waste disposal. Now for protection and well-being, we have to make wash kits, you know, available. That's the sauce, materials, buckets, all the things we need, you know, to protect our students and ourselves. And thermometers available in school. We have to have, you know, a school entry screening in place. And like what Dr. Okunu said, a holding bay, and then educate our learners on signs and symptoms, and those that are symptomatic should stay home. Then an important part is providing psychosocial support to learners, and we have a psychosocial pillar. If you need their support, we'll also share their details with you as well. And then every school should try and keep health records for all their learners. It's very important. And then for learning, like what Lagos said, we can do shifted table if it's not possible to socially distance, physically distance, like double shifting, depending on the size of your school, premises, like for children that miss school, and then e-learning opportunities and as such. And then for inclusiveness, one key thing is that for those of us that have special needs learners, we have to find a way to include them and make sure they do not lose out because of COVID. The capacity building, we should have a training schedule. We should plan trainings for all our staff, teaching, non-teaching, support staff, all of them, so that everybody is on the same page. And then for coordination, we need to have a school health team, like we have been told. We need to have a communication link with, appropriate authorities at the LGA in health and in education, and we to be able to give feedback to ourselves so that we can assess ourselves and find out how well we are doing. And then on our own, we work together with education to make sure that schools will have all the necessary protocols from NCDC. And please, if you don't have, please keep disturbing us so that when there's monitoring done, we can see that, yes, everything you need is on ground. So I want to thank you very much. I think the only part left is infection prevention and control. Over to you, sir, Mr. Adebayo.
Yeah. Thank you so much for that wonderful presentation. We want to thank the Ministry of Health and all their teams, team members for a very good presentation they've given us today.
We still have one more left, sir.
Okay, we have one more left.
Yes, Mrs. Azan.
Yes, we booked 2 hours. Yes, we just spent 1 hour and less 4 minutes.
Yes.
Yes, please let the last presentation please go on. Then we take some minutes to take questions.
All right, sir. Mrs. Azan, thank you.
Good afternoon, everyone.
Madam, good afternoon.
Good afternoon. My name is Shola Hassan. I'm a director in the ministry, and I also work as the state health educator. Our work is to create awareness on health issues and encourage behaviors that promote and maintain health. And on this training, we have done the overview, the signs and symptoms, case definition, and contact tracing. So can I have the slides shared now for my own presentation? Thank you, Dr. Adekito.
All right, so let me share for you. Hold on.
Okay, thank you.
Can you see my slide now?
Yes, I can see, but this is contact tracing.
I'm going to move from there.
Okay.
Okay, here we are.
Okay.
Okay, I think Dr. Adiba has spoken up. Okay, this is your slide. Yes.
I'm going to be talking about preventing the spread of COVID-19 in school. Next slide. For us to prevent COVID-19, we need to have adequate physical distancing, which has been said. We need to have, next slide. Adequate physical distancing, adequate ventilation, hand hygiene, use of mask. I can see that in some of the schools that we did monitoring, that the schools, I can't see the slides again. From some of the monitoring that I saw that a lot of the teachers were not using the mask. And even those that were using the mask were putting it on their chin. So what are we going to be teaching the students to use face mask? And also to have hand hygiene. A lot of the schools that I visited recently, they have packed their hand washing hygiene and hand washing packs to one side. And a lot of them are behaving normal as if COVID-19 has gone. So we need to go back to the normal and start, adequate physical distancing, use of mask, proper use of mask. We need to cover our nose and our mouth when we use the mask. And then I also noticed that some of the people that are using the mask When they want to talk, they pull it down. And then after talking, they pull it up. That's not how it is done. When you use a mask, you have to use it and then talk with it, because some of the viruses might be coming out if you pull it down and then pull it up again. So that's how it is done. And then we also need to take care of our respiratory hygiene, cough etiquette, cleaning and disinfection of the school regularly and on a daily basis. Next slide. Next one, we've talked about this. Now, we also need to, we've talked about adequate ventilation. In one of the questions that somebody posted on the chat, I saw that the person was asking about use of air conditioner in the bus and in the classes. It's not advisable to use air conditioner in the buses and also in the classes, because we need to have cross ventilation so that we can minimize the spread of the disease. We need to open the windows. We need to increase circulation of the outdoor as much as possible. And then we need to avoid the use of direct air from one person to the other. Next slide. We have talked about hand washing. We need to bring back all our hand washing kits to the school, and then use of soap, to wash our hands between 40 and 60 seconds. And then in the case where we don't have hand washing kits, in between, we can always give the students alcohol and base sanitizer to rub on their hands. Next slide. Now, we also need to talk about hand washing. Here are the steps of a hand washing technique. And then when we're talking about hand washing, we need to spend about 40 to 60 seconds washing the hands. The first one is for you to wet your hands with water. The second thing you have to do is to apply enough soap to cover all the hand surfaces. Rub hands palm to palm, and then right palm over the left, with interlaced fingers and vice versa. And then the fourth one is palm to palm with fingers interface. The fifth one is back of fingers to opposing palms with fingers interlocked. And then the sixth process is rotational rubbing of the left thumb, claps with right palm, and vice versa. This is where you'll be able to wash the thumb and then in between the thumb. And then the seventh process is rotational rubbing backwards and forward with clasped fingers of right hand in left palm, and also vice versa. Rinse hand with water and dry hand thoroughly with a single use towel. We don't advise that the towel that we're going to have there is one that every other person will be using, preferably a disposable hand towel is recommended. And then you use that towel to turn off the tap, and then we know that our hands are safe, as it is. Next slide, Dr. Adekito. So when we're using our hand rub, that is the alcohol-based hand sanitizer, we use it for 20 to 30 seconds. We apply a palmful of the product in a cupped hand, covering all surfaces. And then we rub hands palm to palm, right palm over the left palm with interface fingers and vice versa, palm to palm with fingers interlaced, then back of fingers to opposing palms with fingers interlocked. Then the sixth process is the rotational rubbing of left thumb, claps in right palm and vice versa. The seventh process is rotational rubbing backwards and forward with clasped fingers of right hand in left palm and vice versa. Then once it is dry, your fingers, your hands are safe. Next slide. Next slide, Dr. Adekito. Now we're going to talk about use of mask. Masks are not advised for children under the age of 5, and that has been said by UNICEF and WHO. Children aged 6+ years may wear masks in areas of high transmission. Cloth masks are preferred. Next slide. Next slide, Dr. Adekito. So now this is how we should be wearing our mask. You can see the first one that the person was wearing the mask, covering the nose and the mouth. You can see that in the other places, the people wearing the mask were exposing their nose. We shouldn't expose our nose, and then we shouldn't pull down when we are talking. You shouldn't hang the mask on our jaw or neck. And then we shouldn't hang it on our forehead. We shouldn't hang it by the side. We shouldn't touch the front of the mask or inside of the mask. And why we are saying this is that you might have gotten close to somebody who has COVID. And then by touching and fidgeting with the mask, you can get infected through that process. Then we do not use respirators, e.g. N95, if you are not a health worker. You can see in this place that it is shown how the N95 looks like. The surgical mask or the cloth mask is better for us. Next slide. Respiratory hygiene and cough etiquette. I think we've talked about that. We encourage the staff, on cleanliness and disinfection. I think we have talked about that. Next slide. Cleaning and disinfection, we have also talked about that. Regular cleaning, frequently touch surfaces, handles, light switches, stair railings, armrests, tables, shared objects. We should always make sure we clean all those regularly during the day and when the students are in school. So what do we expect from schools? When we have high index of suspicion, we follow the guidelines provided by the authorities, the Ministry of Education, the OEQA, Ministry of Health, and Lagos State Primary Health Care Board. Immediate isolation of suspected cases and notification of appropriate authorities. List contacts of confirmed cases within the school environment. Ensure infrastructure and process for infection prevention and control are in place. And then we should document. Adequate documentation is also very important. Next slide. Thank you very much. Thank you for listening.
Thank you, Mrs. Azan.
Thank you.
Mr. Adebayo, sir.
Okay, ma'am. Distinguished ladies and gentlemen, I want to thank you, Mrs. Azan, for that wonderful presentation. I love the way you've taken it as a teacher, as an educator. You've been able to see the information that has already been given so that you don't repeat yourself. Thank you, madam. At this point,
thank you, sir.
It's open to everyone to ask their questions. There will be 2 direct questions. Then after the 2 people who have been allowed to speak, Madam Fauzia will go to the chat room and read out 1 or 2 questions. And I would love Mrs. Adebayo, Dr. Okunu, Mrs. Shola Azan, and Dr. Adeki Iton to please get ready to answer the questions as the case may be. The floor is open now. You may raise your hand even as you ask your question. Thank you.
Adebayo, thank you, sir. Okay.
Please hand. Let me start from Mr. Keola Amidst. Mr. Keola, you can ask your question now. Mr. Keola, please unmute yourself.
Hello.
And speak.
Hello. Hello.
Yes, we can hear you, sir.
I'm from Buffett Home Zone School. Yeah, no, Abui and Okwaja. And my question is, in a kind of situation whereby we have only one. Hello?
We can hear
Okay.
you, please.
If there is only one room for that we can use for caring in case there is any COVID-19 cases, I hope one isolation center is enough for a school.
In a school, you have to set a room apart as isolation room. You have to have
Yes.
You are not likely to have 20 children discovered on the same day. If it's only one person you have found to have the symptom, remove the person and take the person to that room until you call for help.
All right, sir. Thank you,
Thank
sir.
you. The next
Thank you,
question,
Mr.
please.
Adebayo.
Hello, sir.
Yes, ma'am.
Just to add to that, it's not, we do not expect that the isolation room should be your clinic as well. You have to separate them for safety's sake. For example, if a child is already ill in the clinic, being seen in the clinic for something else, you cannot bring a suspected COVID case to the clinic as well. Is that all right? You must separate them for safety's sake. Thank you.
Okay, we may take two more from the participants. More hands are being raised. So maybe I should take a female this time around. Mrs. Sherifat Olabi.
Thank you. I was thinking we can take 3 or 4 questions, then you answer them all together.
Okay, sir.
You just identify somebody now, please.
Mrs. Sherifat.
Good afternoon, ma'am.
Good afternoon, please go
Well
ahead.
done, and you have really tried this. I heard that you just said that when we are in school, the nose mask is meant to be used throughout, fine. But that we should not release it. How far is it safe, ma? That we should not release it. It has to be used
Hello,
to cover the nose and the mouth. Can you get my question, ma'am?
We got your question.
Ma?
We got your question. Please, we will respond. Just
okay, thank you, sir.
You're welcome.
Okay, what I said is that concerning the nose cover.
Hello, Dr. Adekito.
Concerning the nose cover, ma.
Sorry. Hello, please. When you have asked your question, please stay offline. The next person will ask that question. We will take about 3 or 4 questions, then respond, so that we don't waste time. Thank you. Please, Olukorede Aribabu, please ask the question now. Madam Olukorede, unmute yourself and speak, please. Okay, I think we lost her. Abiodun Oshikoluke, can you please ask your question? Abiodun Oshikoluke, please unmute yourself and ask your question. Mrs. Oshikoluke. Okay, Mrs. Oyerogba Yetunde, can you please ask your question? Please unmute yourself and ask your question.
Hello, good afternoon.
Good afternoon, madam. Is that Mr. Yoruba? Hello.
That was Mrs. Sherifat, and she has given her contributions.
Okay. Mr. Yoruba, you are on. Okay. Abogunjoko. Mr. James Abogunjoko, can you ask your question now, please? You can unmute yourself and speak. I find it difficult to unmute themselves.
Only.
Can you ask your question, please?
I think you said you have gotten my question, sir.
Okay, and she asked you to answer. I'm calling according to answering. Samuel Ojo, Mr. Samuel Ojo. Mr. Samuel Ojo can ask his question now.
It seems people are finding it difficult to unmute themselves. But we have Mr. Irene Sampson. Please go ahead.
Okay, good afternoon, ma. Good afternoon, sir. I have two questions quickly. What are the furnitures that the isolation room must have? My first question. Isolation room, which furnitures, what are the things I expect to see in the isolation room? One. And then for younger children, the nursery children, they don't like wearing mask or face shield. What do we do concerning those ones? How do we manage them? Because when we put it on, they pull it off and they destroy it. How do we manage them? What would you advise on how we can manage those ones? Thank you.
Mrs. Oluyemi Samuel. Oluyemi Samuel.
Cleaning.
Oluyemi Samuel is not on. Irene Sampson, can you ask your question? Irene Sampson.
Hello, sir. Can you hear me?
Yes, we can hear
Hello.
you, please.
Okay,
Yes,
thank
sir.
you, sir. I said two things, sir. Two questions. The first one, isolation room. What are the things that we expect to put in the isolation room? What furniture? What equipment? What are you supposed to have in the isolation room? First question. Second question, for younger children in the nursery classes, using mask and shield is always a problem because they destroy it, they pull it off. How do we manage them? What would you advise on what do we do to manage and ensure that everybody is safe? Thank you.
We'll answer that question very shortly. Let's take one more. Madam yesterday, please commit yourself and speak. Yesterday.
She has dropped her hand. I think so far, those are the people.
I think the questions they've already asked, Mama. Dr. Adekiton. Dr. Adekiton, please.
Hello?
Dr.
Okay, Doctor.
Okay, this is Mrs. Hazan.
Okay.
This is Mrs.
Okay,
Hazan. Okay, let me just answer some of the ones I have put down here. The person that was asking about how safe the nose mask is, that should they be using this nose mask from morning till afternoon, that how safe it is. That's why we are saying that you shouldn't be using the N95. The surgical mask or the cloth mask is okay, as long as you practice social distancing in the school. So, and you are going to sew that mask in such a way, if it's a cloth mask, you will sew it in such a way that it will fit you snugly and it will be comfortable. It shouldn't be a mask that will be too tight. If it is too tight, you won't be able to talk through it. So we are advising that you get a mask that is comfortable on you. and then you talk through it. You don't remove it till you close in the afternoon, because you are going close to the children, to the students. So, and if you remove the mask, you might be endangering the lives of the students, because you don't live where the students live. You live in different places and you have contacts with different people. So it is advisable that you get a mask that is comfortable. And then somebody asks of the furnitures that is supposed to be in the isolation room. I think the furnitures, you don't have to have a lot of furnitures there, just the chair, the table, and the bed is something that you should have in the isolation room. And then probably the first aid box, you should have it also in the isolation room. And then somebody talked about the kindergarten children, that they remove the mask and destroy it. We are saying that the mask is not even, WHO has recommended, and UNICEF, they have recommended that the children under 5 should not even use the mask. So, and what we can do in this wise is to make sure that they have enough distance between themselves. Enough distance between themselves. That's the only way we can manage that. So that's about what I have written down here. My other colleagues will answer the other questions. Thank you.
Thank you, Ma. Thank you so much, Ma, for answering that. I will just take a few comments from the chat box that I've seen from our participants, for those that could not unmute themselves. So we have, okay, and then we have 2 comments too from our live YouTube stream. So somebody wants to know if, how long will this process take? Sample collection to when the results get back to school. So I think that was during Dr. Abisola's section. So that question was dropped in the live stream. And also, will these forms be shared with every school? That's from our live YouTube stream. But in this webinar, the questions in our Q&A session, if someone tests positive but is asymptomatic or showing, what medication would you advise to help boost their immunity? I think Dr. Abisola has already answered this question. Okay. Most of the questions in the Q&A session has been answered, but the ones in the chat box.
Hello.
Hello, Ma.
Can you read out the questions in the chat box?
Okay, so I'm just trying to see the ones, because most of them, some has been answered. So I'm just trying to see the ones that are peculiar. Okay, so somebody said the fear of lockdown or closure of school might not allow some school owners to report any case of COVID-19 in their schools. How can this fear be removed? And this person is the president of an association and is asking on behalf of some of his members, that how can this fear of lockdown or closure of school, that the fear will not allow them report cases. So,
okay, hello.
Hello, Ma, please go ahead, Ma.
Hello, the fear of lockdown is not what we should look at, because the issue now is that we are looking at children, and then if you have a case and you are not reporting it, it's like you are aiding and abetting an outbreak. And then if you will find out later, then it's going to be a problem, because this is a pandemic, and then every case must be reported, and it's under the law. So any school that is found that you have a case and you didn't report and you are found out later, because of the fear of being locked down. Being locked down is not as important as the health of all the children you are caring for. I think the life of these children come first for us. And that is why for you to have the fear of being locked down, that shouldn't stop you from reporting a case. However, it should spur you on into ensuring that everything is adhered to so that no child gets to bring in COVID into the school. And nobody had said that once a child is seen in your school, the school will be shut down. Investigations will be done. If there is need for the school to be closed, obviously, it's going to be for the safety of all. Safety first before anything. Thank you.
Thank you, Ma. I think the answer you just gave too will be relevant for this person that said, good afternoon, my wonderful facilitators. My question is that if the school suspects a student to be displaying symptoms of COVID-19, such as running nose, weakness, headache, etc., and advises accordingly that such a student stays at home to treat himself, or better still go for COVID-19 test. So her fear is that the parent might come forward to accuse the school of stigmatization of their child. So what can they do in this regard? And I feel your previous response can take care of that, except you want to add more to it, Ma.
Hello, Dr. Rikito.
Mrs. Hassan, maybe Mrs. Hassan should speak on stigmatization in schools. Mrs. Hassan, do you want to handle that question?
Hello?
Hello, Ma.
Okay, when we're talking about stigmatization, it is not something that should be encouraged in the schools, because COVID-19 is just like any other disease that anybody could be having. So it is just for us to encourage the teachers and whoever is in the school to discourage even if it's the pupils that are stigmatizing, just let them encourage them to stop stigmatization, because they might also have it any other time. So it is just advisable that they discourage them from stigmatization and tell them that it's just like any other disease. It's just like hypertension, it's just like diabetes, just like HIV and AIDS. And we know that all those people that are having all those diseases are not being stigmatized. So, and that's how we should treat COVID, to discourage stigmatization. Thank you.
Okay. Thank you, Ma.
Hello, Ma. Hello, Ma, can you hear me?
We can hear you, Ma. Please go ahead.
Okay, so I saw a question in the Q&A on the chat, which was not answered. So I'm looking through it and I just want to read out the question. Please suggest some ways persons who violate COVID-19 safety protocols may be made to face consequences despite all efforts to educate and advise them. It's Simon Ape, and I'd like to give my views on that. If it is a pupil that has been told before, if it is a teacher that has also been informed before with proper education and advice and they still break those protocols, I would believe that pupil and that teacher can be asked to go home and not come back to school until they are ready to adhere. Because it is safety. This is safety we're talking about. We're talking about other people's children. We're talking about other people, teachers and co. Once an individual comes into a class not wearing the mask, he shouldn't be allowed into the class. Even the teacher, people can correct you. Excuse me, sir, please wear your face mask. In our offices, you are not allowed to come into our offices without your face mask on. Properly, you covering your nose and your mouth. We ask the individual to stay outside until you are ready. If you don't have a face mask, you go back. You go back downstairs and go and buy one, because you shouldn't even have been let up the stairs. So I believe that we can all look into that. People should continue to tell people where they are wrong, that they need to wear their masks, they need to cover their nose and their mouth. If they continuously do not adhere, that pupil and that teacher can be asked to go back home and inform those at home of the reason, especially if it's a pupil.
so that their parents are aware why they're being asked to stay home until they are ready to adhere to protocols. This is safety. This is everybody's individual responsibility. It is for the child that has been told to wear their mask. It is for the child that is not wearing to be told, put your mask on. So there's also a question that came up with nursery pupils. We said those under 5 should not wear masks. Those 6 and above should wear. Number 1, the mask should be snug. So sometimes the surgical mask cannot work for children from 6 to maybe 10. My daughter is 10, and the normal surgical face masks are too big for her. I had to find a company that makes face masks so I could make a pack of 5 at 1,000 naira for her. There are other people that sell masks all over, but the surgical face masks do not work for children 6 and above. So cloth masks, even if you take it to a tailor to sew specifically to that child. And as well with the nursery pupils, it is the duty of the teachers to monitor those children. When you see them not wearing their mask, you help them put it back on. This thing is a full-on individual responsibility and monitoring and supervision. You supervise those little nursery children to wear their masks, and you supervise them not to share. My daughter is 10 years old, and as she's leaving home, I said, please, your friend's mask is not cuter than your mask, so you decide to take a mask and share it. No, stick to your own mask. So thank you. That was for that one.
Thank you, Ma. From our live stream, somebody asked, good afternoon, please, who pays for the COVID test, and what's the plan to help a child that may face stigmatization?
I'll answer that, and Dr. Adebayo will answer it as well. When it comes to the COVID test in Lagos State, samples are taken at the local government and at the Yaba Isolation Center. These are our public health facilities. There is no charge for these tests that are taken at the local government and at the Yaba Isolation Center, as long as that child shows symptoms and that child falls into case definition. Even the teachers are covered to have their samples taken for free, as long as they fall into case definition. We have to be honest. Lagos State is spending a whole lot of money, to be honest, to test. And we are testing for free. When it comes to, people talk about the different costs of 35,000 and 50,000. Those costs are at, the 35,000 is at the National Institute of Medical Research, which is a government facility under federal. The private laboratories charge 50,000, but they charge it to those that, 1, wish to pay, 2, Dr. Adebayo is speaking, is here as well, and those that wish to use it for testing and immediate testing. If a child is taken, that child, as long as that child falls into case definition, will be tested at our centers, local government, and the Yaba Infectious Diseases Hospital. Dr. Adebayo, I think you can unmute to answer as well. Unmute yourself. Your hand is raised, so you can answer.
Thank you so much. I don't know what happened to my network. For the past, I just realized I wasn't hearing anything, so I had to log out and log back in. So anybody that has testing that is epidemiologically generated will be tested for free by Lagos State. So if a child is symptomatic, that child will be tested either at the closest LJ to them or at a mainland hospital walk-in site, or even we also have a walk-in site at Luz as well. So that child will be tested, and if there are challenges with that, please get in touch with the disease surveillance and notification officer. Thank you.
Wow. Thank you so much for that response, and I'm sure that our participants following from the live YouTube channel got that. I would like to, before I pick the next question, I would just like to acknowledge the presence of the DG OEQA in person of Mrs. Abiola Seriki Ayeni and glad that she could finally make it join this meeting before, or this webinar before it's over. So on to the next DJ, you're welcome, ma'am. So the
Good
next
afternoon,
comment.
everyone. Thank you so much.
Good afternoon, ma'am. The next person here said, if a child is sick and parents refuse to disclose or disclose his or her illness to the school, can we demand for clearance from the doctor before allowing the child back into school?
I would say yes. I would say yes. You can demand. I can give a typical example. My children, one of them tested positive for COVID-19, but she was asymptomatic. To go back to school, I notified the school. There is a list of questions the school required. Has that child had malaria, a test for malaria, been in contact with anyone with COVID? I notified the school. And this was after the period. The school has the right to ask me for a test. And I would provide the test results to them, a negative test result for that child to go back to school. So yes, if the parents are being a bit unclear, the school can ask for testing. However, the school must have notified the parents ahead that this is our plan. As part of our safety protocols, after our interface with the Ministry of Education, we would like to know if your child has fallen ill so there's like a health questionnaire when children are coming back to school, to be sure. Because that's the only way. We all know that the issue of stigmatization, people are keeping quiet about COVID-19, and there's no need to. It is just to protect all other children that may be involved. So yes, if that child is being difficult, if that parent is being difficult, you can ask them to provide a test result from a reputable lab before the child is allowed back into school.
Okay, thank you, Dr. Okuno, for that response. Thank you so much. We have so much comments in the chat box thanking you, saying this is absolutely beautiful and expressing their, gratitude that it's an eye opener. So this shows that this webinar is very important, and as we said that it promises to be interesting, we can absolutely see that our participants have enjoyed the session. Thank you so much, the facilitators. Maybe I just take two more before we round up. So the question about underage pupils under 5 in school, that they are not to wear masks. So somebody is asking, how do we then protect them since they are not allowed to use the face mask?
Hello.
Hello, ma'am.
Okay, concerning the children below 5 years, what we'll do for them is they can't wear the face mask, like Dr. Kuno had already said, is 5 years and 6 and above. So what they can actually do is that as the teacher in the class and helper, we have to be more vigilant. What we advise is that there should be hand washing session during classes. Before, when a child is going to the restroom, somebody guide the child. In some places that we know they don't, the child just get to go on their own and come back. So we need to make extra effort to ensure that these children get to wash their hands and then use hand rub. At least hand rub can be used every hour. Hand wash should be done like every 2 hours, or hand rub every 30 minutes, hand wash every hour. So it has to be our own active thing doing. As we have to be active about it. It's not like leaving them to do.
Hello, Dr. Adekito.
Their thing is no more business as usual. Just effort to ensure that these children, and as with that, we also clean surfaces of the virus is taken out from the children. Because one, like I said before, one intervention is not enough. You can't wear mask and not do social and physical distancing. So these children, the only part of this that they cannot do is the face mask. But every other thing that needs to be done needs to still be done, and so that we can get the same results. Thank you.
Okay, thank you very much, Ma. So a lot of participants are asking if they will get this slide at the end of the session, but as it has been promised, we are going to send it to the registered email addresses that we have for those that registered for this webinar. So we'll be sending the Dr. Bisola shared
Hello.
the list. Hello, Ma. Hello.
I think Dr. Adebayo, we have to answer that. Concerning the slide, she's putting up her hand. Dr. Adebayo, can we hear from you?
Oh, okay. I was even talking about the list of personnel that she shared with me, that we'll be sharing that too with the participants.
Okay,
Dr.
concerning this slide, she will answer us on that.
Okay, Ma. Okay.
Dr. Adebayo.
Hello. Also, maybe you answer it together. And they also want to know if a certificate will be administered at the end of this webinar, or if they will get a certificate in their email addresses.
I think OEQA can answer that about the certificates. I think OEQA can answer the part of the certificate. But I believe Dr. Adebayo was raising her hands. Dr. Adebayo, were you raising your hand at a point?
Yes, I was raising my hand. I wanted to say for preschool, I know what some schools do. The children can also use the face shield, like for preschoolers, as an option as well. I know some schools are doing that, so that's an option.
I think the person that asked the question said that the children don't even tolerate the shield also. They don't want it on. So that was why I answered it that way, because I know the shield.
Yes, so I agree with what you have said. At that age is a little more difficult. Some children are used to it, like my son is 4, he wears that mask every time, but some children is uncomfortable for them. So we just work with them, do hand washing and all the other things, that you have said, Dr. Adekito. Thank you.
You're welcome.
Regards the slides, Ma.
Oh yes, definitely, Ma. We'll make the slides available.
Okay, thank you very much.
Yes.
Oh, okay, thank you for that. Mr. Adebayo, sir, I was almost saying Dr. Adebayo.
Dr. Adebayo is on the line.
There's a Dr. Adebayo on the line, yes. Okay.
An extended family. I think we have only 4 hands up. Can we quickly take those 4? Because I think we should be able to close this meeting at 3:30, and we have about 8 minutes to go. Out of those 8 minutes, I think we'll give Dr. Ogunsoya 2 minutes for a closing remark. Then our DG line now, I would like her to say 1 or 2 as well before we close it down. Quickly, Vazia, can you please unmute? Look as if people are finding it difficult to unmute themselves.
Okay, sir. Right now, Mr. Patience, you can, Patience EJ, you can please unmute yourself and give us your contributions. Then followed by Ms. Moyo Sola, and lastly, Mr. Ojo Joseph.
Mrs. Patience EJ, can you please make your contribution or ask your question, please?
Though I feel sometimes some people just randomly, mistakenly use the raise hand button. So I don't know. Because I can see the hands have dropped. Okay, Mrs. Patience.
Hello, ma'am. Good afternoon.
Okay. Good afternoon.
Good afternoon, everyone. Thank you so much. Like it was pointed out that for the younger children on what we need to do to ensure that they're okay, keeping the distance in the class and ensure that they keep their hands to themselves a bit. I think that is well noted. Then the issues you pointed out about ways we can, continue to sanitize or disinfect daily. We are doing all of that in our school, and
Hi there, good night.
it's the constant reminder on what we need to do is well appreciated by the organizers. Thank you so much.
Thank you, Ma. Thank you for the contribution. I think finally, before I hand over to before we make Dr. Busoya's remarks, sir, there was one thing that struck my attention, and the person asked, "How do we identify fake, or how do we identify a good hand sanitizer? That there are a lot of sanitizers in the market. So how do we know the ones that are effective?" So I saw that and it caught my attention, and I'd like the doctor to please respond to that.
Good afternoon. Yes, I was just answering that. I was actually typing in the answer. A genuine hand sanitizer should have alcohol content of above 70%. 70% alcohol based and above. Ordinary methylated spirit has an alcohol content of like 99%.
Okay.
So if some people actually are happy to add methylated spirit to those hand sanitizers to increase their alcohol content. But if you're buying one, you can check it. The alcohol content should be above 70%.
Okay, ma. That's well noted and taken. It's important to know that it is alcohol-based hand sanitizer. On that note, I think we're through with the question and answer segment, and I'll hand over back to Mr. Adebayo. Thank you, sir.
Thank you very much, Althea. Just before I call on Dr. Busoya, Mrs. Basti, Choma is asking, how do we handle asthmatic patients, asthmatic students that are asthmatic? How do we handle them with the use of face mask? Possibly there is some counsel you want to give them, doctor.
Dr. Adebayo, do you want to answer this or I should?
Yes. Dr. Adebayo, please. Hello?
I think Dr. Adebayo.
Dr. Okuna, I think you can go ahead.
Okay. When it pertains to asthmatic children, those children are already aware of their medical condition. So those that carry around their inhalers and co are already, that your regular medication, all your regular medication should be with you. That is why for children, we also advise the cloth masks. The cloth masks are better and more, they aid their breathing better rather than the surgical masks. But as well, for asthmatic patients, they should have their inhalers, their necessary medication on hand, and avoid all the allergies, anything that can induce allergies around them. So that is what we would say for asthmatic patients.
Also, just to add, for asthmatic patients, that is why we've been hammering on school health records. If the school health record is actually sound, we already know our students that have underlying issues. So for the child that is asthmatic, wearing a face mask may not be the child's trigger. For asthmatic patients, they have different triggers. Some of them dust, too much exertion, and all of those things, grass. So if the school health information is intact, the child can still wear face mask, and the child will know if you have to try, because the child is asthmatic, they are vulnerable. We should even pay more attention to them when in this time of COVID, because they are more vulnerable. The way ordinary child will actually contain COVID, they may not be able to. So for every slight of complaint they have, you should just educate them that at every point that you feel this way, that's for a child that can wear face mask, and I'm sure they are aware of what their ailment is, will come up to say, I feel funny. And then at that point, we can go ahead. But if we say the child should not wear face mask because he's asthmatic, is choky, then we'll be running into a bigger trouble with an asthmatic child. So it's high level of suspicion and taking responsibility will have to come in also in this. Thank you.
Mr. Adebayo, sir. Mr. Adebayo, please unmute yourself, sir.
Hello, can you hear me?
Yes, sir.
Thank you. So I want to thank our facilitators and the participants for a good outing. At this point, I want to invite Dr. Ogunsanya for a comment. Thereafter, I will invite my DG for a closing remark. Dr. Ogunsanya, please, you are on.
Thank you very much, Mr. Adebayo. Good afternoon, everyone. Good afternoon, DG OEQA. Thank you very much indeed for this opportunity, again, to be informed and enlightened. It's been an amazing session. The Quality Assurance, the Office of Education Quality Assurance has done a lot of training for schools in the past. And now being able to listen with the Ministry of Health to confirm all that we had heard from the Office of Education Quality Assurance with expanded information. It's truly amazing. I've always paid kudos to the Ministry of Education, to the Office of Education Quality Assurance, that we are partners in progress, and that therefore all that they do, we must key into to work hand in hand with them towards the protection and safety of all the children under our care. I had admiration and respect for the Ministry of Education from a distance, from the way that the Ministry of Health has cooperated or partnered with the Ministry of Education in handling some outbreaks in some schools. Listening to the presenters of this afternoon, Dr. Okuno, Dr. Adebayo, Dr. Adekiton, Mrs. Hazan, has raised the bar of respect I have for the Ministry of Health, because it's been a very, very informative, very, very enlightening session. You took us through the presentation slides, you answered all the questions, and it has given another layer of confidence to us as school owners, to us as the ones who look after the children at the primary level, at the front level. We have the front officers with students in schools. So it's given a layer of confidence to our operations, to all that we do. Some of us might have come with plenty of knowledge about COVID-19 and what to do, but this afternoon, we've raised the bar of the information and the enlightenment that we have. So once again, I'll say a big thank you to the Office of Education Quality Assurance for partnering with the Ministry of Health, and for the Ministry of Health insisting on us attending this webinar. We're going away with a whole lot of information, who to contact at the local government level, areas that we want, even the furniture that we need in an isolation room. We have a lot of information today. I'd like to say a big thank you for the opportunity of this webinar, of this interaction. And I'll add my voice to yours about this issue of stigmatization. What I say to people is HIV might have been caught through use of drugs, through other means that might not be that palatable. But for COVID-19, it's like catching the common flu. It's like catching the common flu. And therefore, we have to find a way of dispelling stigmatization in our schools. And it's an unseen enemy. We don't even know. If we knew where it was, we would avoid it. It's an unseen enemy, and anybody and everybody can contact COVID-19. So it's not selective. It's not only for some social group in the community. And therefore, we need to raise our voices in our respective schools to educate both our parents and the students, so that this issue of stigmatization will gradually die away. We don't need to stigmatize. People don't need to feel shy. It's by having the conversation on a regular, continuous basis that people will now be able, because I know people hide. They hide the symptoms. They don't want people to know. And it's dangerous for the rest of the community, as we have had this afternoon. So please, as we go back to our respective schools, our station presidents, let's have opportunities of this conversation, especially to do with this issue of the stigma. It's not like being promiscuous and catching, what do you call it now? Sexually transmitted diseases or something silly like that. This is something that nobody knows where they can get it. And therefore we should be open about it. So once again, I say a big thank you to the team of the Office of Education Quality Assurance, ably led by dear Mrs. Sheriki. Thank you very much indeed for this opportunity. I say a big thank you to the Ministry of Health, and please extend our appreciation and kudos to Professor Abayomi and working with Mr. Governor in the way that Lagos State is handling the coronavirus in Lagos State. We're very proud of you. Thank you very much. Keep up the good works.
Thank you very much, Dr. Gusaya, for that wonderful vote of thanks. At this point, I want to invite the Director General, Office of Education Quality Assurance, for our closing remarks. DJ Ma.
Good afternoon, everyone. I hope you can hear me.
Yes, madam, I can hear you.
Okay, thank you. You know, we got a little bit of the training, the QA team last week with health, and I can just imagine how much more informed everyone on the line is. Even we as government, when they went through the presentation with us, we walked away with so much more information than we did before they began. I want to thank our health team through the OEQA Collaborative Technical Working Committee for their commitment to ensuring that we are able to finally flag off the training that we have been talking about for so long. It is obvious, even though I joined quite late, it is obvious by the comments and all that has been said that it has been an interactive and very solid session. And I want all of the school owners, principals, proprietors that are here, I want you all to spread the word of the wonderful trainings that are still coming up. A large proportion of that training will be centered on health, similar to what has been done today. But the other training sessions that we're planning to give to the general public will be centered on, you know, how schools during this time can come back stronger. You know, so we have different topics that we will be addressing with different subject matter experts. So as you can see, we have people from health here today, but for those other topics, we'll be working on emergency preparedness during this time, lesson planning, finances of the school, management, everything that contributes to quality learning, teaching in schools. We will be addressing those issues head on as we go on. I just want to read to you some of the topics to expect. So in the phase 1, we'll be going through business and financial management. Some of the topics will be school cash reserve, school fees, school finance. Another topic will be school reopening, preparing the school, preparing staff, managing well-being, continuity of support. The third would be emergency, remote, and blended teaching. And the fourth would be technology for learning and management. Under that would be tools for communication, tools for learning, tools for management, and so on. So this is just in the first page, and this information will be brought out to you. But those of you that are here, I just wanted to give you a snippet of what to expect in our Leadership for Renewal training series that will be coming up as a result of COVID-19. Another thing that I want to bring to your attention here, since I have the opportunity, I want to share my screen. So you should all be familiar with the OEQA website, oeqalagos.com. We are going to start visiting schools toward clearance. Many schools submitted their plans. So that is the operational plans, health, safety, sanitation plans, learning plans, and communication plan. After they have scaled through that, we will then visit to be able to issue out clearance. And we'll begin that very soon. So I wanted to let you know that prepare for that. The schools will be informed before we go to their campuses. Another thing is, I want you to keep in mind that we have key documents here. We have the federal government guidelines, self-assessment and safety checklist for reopening of schools, child protection and safety guidelines, guideline for the prevention management of COVID-19 in schools and boarding facilities, emergency guidance, and then the OEQA rapid assessment tool for online learning as tools that you could all use within your schools. The last resource that I want to share with you now is this incident report form. So we realized that many complaints were coming to us haphazardly. Maybe if someone knows the commissioner or if they know me personally, they'll send pictures. You know, how can this school be in operation? They're not maintaining social distancing. So I'm bringing this to your attention for two reasons. Number one, for you to know that we are going to be sensitizing not just you as school owners, but also the general public about the fact that this reporting mechanism is in place. So anyone, for any citizen to report issues at this time, and also for you to know and to be aware that if there are issues that need to be reported, they can be done so here. So these, the major issues that are going to be reported, the type. So this is not just the general reporting, but this is when it comes to safety of infrastructure, child abuse, overcrowding, non-compliance, COVID-19 safety protocols or other. Okay, so this is just to let you know and to get the word out so that you know that this is just the first line of defense that we have for reporting of, you know, incidents that may happen in both public or private schools. So that is that. How do I, okay, stop share. So that's done. I want to thank all of our participants. I was told that we reached 300 today. I want to thank all of you for coming, taking time out. You could have been doing any other thing, and for you, this is a priority, as it should be. I want to thank all of you for participating, and I want to encourage you and also let you know that we are expecting for all of you to continuously maintain those protocols we know to be tried and true. Social distancing, now the government has said no gathering of more than 50, I believe, so that also obviously applies to schools, public and private. So maintaining social distancing, wearing of masks, and frequent washing of hands. We are always here to support you, but we are holding you all accountable as we go about our monitoring. I want to again thank our team from health. I want to thank COPSAIL for getting all of the schools on board and all the teachers, principals, school heads on board for this. And of course, last but not the least, our internal team, the OEQA team, all my head of departments, my directors, all staff that have contributed to the success of this program. I do thank you all. Thank you and God bless you.
Amen.
Thank you very much, the DG. On that note, I have the permission of the DG to declare this training closed. Thank you and God bless you. Bye-bye.
Bye-bye.
Thank you, everybody. Thank you very much. Thank you. Goodbye.
That's fine. Bye-bye.